Now, the pelvic rock is, to me, the basic exercise that you will do. This is one that you will do at certain times of the day, always before you go to bed at night. It will make your life bearable and comfortable during a pregnancy. If a doctor ever said to you, you have backache when you're pregnant, put up with it, this will prove him wrong, her wrong. And it is accepted that you will have backache when you are pregnant, and it is really not necessary. But this is based on the premise that our bodies are built the same way as a four-footed mammal's body is built, as far as where the uterus is attached. It is attached on the inside of your pelvis, and it hangs down. If you let your uterus hang down when you're standing in an upright position, you're going to be very uncomfortable. The weight just pulls on you. It pulls your back out of shape. You're going to have the sway back that I mentioned earlier. And so what we need to do is build up those tenderloin muscles that run along either side of your spine, along your back, enough so that when you're in an upright position, you can maintain that straight back. When you're in an all-fours position, you can let it sag. It relaxes the uterus out of the pelvis. It releases all the pressure that's inside the pelvis as the uterus is stuffed in there. The blood vessels run that supply the uterus with blood, and all the nutrients and oxygen are inside the pelvis. So when the uterus gets big and pushes against those vessels, you don't get proper circulation. It is just not really appropriate for us to be on 2 feet when we're pregnant. But we have to overcome that somehow. So we strengthen those muscles so that it will work. So if you will just get on all fours, give me a little more space here. Good. Now, you can see that Evan's hips and knees are in a line. Just stretch forward a little bit. You can see how that is not the same. And frequently when you get into an all-four position, you will think that your hips are directly over your knees when you are really like this at a slant. So come back and straighten up. All you have to do. And if you could look at yourself in a mirror while you're doing it, it will help. Or if you even have a light that shines a shadow on the wall, it will tell you whether you are in an upright position. Now, you see how nice and flat her back is. It wouldn't hurt if you did the great cap stretch that we get in yoga, but we're not going to do that. We're going to isolate right here and try to develop a strength here, because this is where your uterus is attached. Now, at this point, if you would just relax your uterus, let it fall out of your pelvis, then it puts her back into a sway. It releases the pelvis, it releases the uterus out of the pelvis, which hangs down low. And it does put some pressure here, but she's supporting herself. She's a bridge. She's not a pole right now, as you would be on 2 feet. She's a bridge. And so she's very secure, and it doesn't hurt for this to be in this position. Then if you'll push up on my hand right here, tighten. And when you tighten, these muscles tighten, and you will feel a band, which are ligaments really, that come right through here and strengthen and tighten your abdomen. Now relax back down again. And it should be done slowly and comfortably. I'm not going to give you timing. You need to remember to breathe. You can breathe in when you pull up, and you're flat and you're tight. And then you relax back down. Now, I would like to know that you are going to do that 20 times, 4 times a day, and at least 40 to 80 before you go to bed at night. And you can double all those figures if you like. Now, to relax, if you're going to take a rest and then come back out of this, you can get into what I call the fetal position. Dr. Bradley called it the froggy position. But what you do is just what you've done. Go back onto your heels with your bottom, and then just put your arms and support your head forehead, chin, whatever. Now, Evan is very good at this, and you will not all be this flexible, but isn't that relaxing? It's a very comfortable position, and it still allows the uterus to be out of that cramped position in the pelvis. The fact of the matter is we weren't designed to carry this heavy uterus in an upright position, and so we're going to do everything we can to give it enough time to be out of that cramped position while you are pregnant.